Welcome. Today we're diving into a common yet often misunderstood eye condition, pterygium, particularly when it extends onto the cornea. Join us as we explore its causes, symptoms, and how it's managed. What exactly causes a pterygium? While the precise etiology remains unclear, prolonged exposure to ultraviolet radiation from sunlight is the primary culprit. Other contributing factors include chronic eye irritation from dry, dusty, or windy environments. Think of it as your eye's response to years of environmental stress. Let's understand what's happening beneath the surface. Pterygium involves an abnormal growth of conjunctival tissue. That's the clear membrane covering the white of your eye. This tissue progressively invades the cornea, the clear front surface of your eye. This growth consists of fibrovascular tissue, meaning it contains both fibrous and blood vessel components. Think of it as the eye trying to protect itself from chronic irritation, but in an overzealous and ultimately problematic way. Pterygium is a global phenomenon, but it's more prevalent in regions closer to the equator, aptly known as the Pterygium belt. Populations living in sunny, hot, and dry climates are at higher risk. It affects people of all ages but is more common in adults, typically after years of cumulative sun exposure. Its occurrence is related to how much you are exposed to the sun in your lifetime. Now, how would you know if you have a pterygium? Early stages might be subtle, appearing as a small, painless growth on the white of the eye. As it progresses onto the cornea, symptoms can include redness, itching, burning, blurred vision, a gritty sensation, and sensitivity to light. If the pterygium becomes large enough, it can distort the cornea's shape, leading to significant astigmatism and impaired vision. Remember, any changes in your vision warrant a visit to your eye doctor. Diagnosing a pterygium is typically straightforward. Your eye care professional can usually identify it during a routine eye exam using a slit lamp, a special microscope that allows a detailed view of the eye's structures. They'll assess the size, extent of corneal involvement, and any associated symptoms. Sometimes corneal topography, a mapping of the cornea's surface, may be used to evaluate the degree of distortion caused by the pterygium. While classifications aren't always strictly defined, pterygia are often categorized based on their size and the degree of corneal involvement. Some descriptions use a grading scale to quantify the extent of corneal invasion, while others simply describe them as small, medium, or large. Recurrent pterygium are also classified as a specific type, describing the reoccurrence of pterygium after a prior surgery. Treatment for pterygium depends on the severity of symptoms. Mild cases, especially if asymptomatic, may only require observation and artificial tears to relieve dryness and irritation. For more significant symptoms or progressive growth, topical steroids or nonsteroidal anti-inflammatory drops can help reduce inflammation. When a pterygium significantly affects vision, causes persistent discomfort, or is cosmetically unacceptable, surgical removal is considered. Surgical techniques have evolved, with conjunctival autografting, where a piece of healthy conjunctiva is transplanted to cover the surgical site, becoming a standard approach to minimize recurrence. Amniotic membrane transplantation is another option. After surgery, medication is prescribed to assist in healing. Close follow-up care is vital to monitor for recurrence. Prevention is key. Protecting your eyes from the sun with sunglasses that block 100% of UVA and UVB rays, and wearing a wide-brimmed hat when outdoors, especially during peak sunlight hours, is essential. Lubricating your eyes with artificial tears, especially in dry or windy conditions, can also help minimize irritation and potentially reduce the risk of pterygium development. The prognosis for pterygium is generally good, especially with prompt and appropriate treatment. However, recurrence after surgical removal is a possibility. Recent research focuses on refining surgical techniques and developing new pharmacological approaches to minimize recurrence rates. Advances include the use of anti-angiogenic agents to inhibit blood vessel growth within the pterygium and improved methods of conjunctival grafting. Continued research promises even better outcomes for individuals affected by this condition. Thank you for watching, and remember to prioritize your eye health.